You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode, I had the opportunity to speak with current AAEP President Dr. Tracy Turner about physical exams. We discussed everything from why thorough physical exams are important, what they can tell you about a patient before you send them for imaging, and how you can improve your examination skills. This episode of the Disease Du Jour podcast is brought to you by Bimeda Equine. Dr. Turner is a partner in Turner Wilson Equine Consulting in Stillwater, Minnesota. He retired from private practice in December 2023 after concentrating exclusively on equine sports medicine, lameness, and surgery at his Turner Equine Sports Medicine and Surgery. Dr. Turner received his veterinary degree from Colorado State University in 1978 and served on the faculties at the University of Illinois, University of Florida, and University of Minnesota. He volunteers with the Equitarian Initiative, serves as an FEI examining veterinarian for show jumping, and has consulted for U.S. Equestrian Federation and USDA APHIS Horse Protection Program for Tennessee walking horse welfare. Thank you, Dr. Turner, for joining us today, and congratulations on your appointment as AAEP President.
Thank you very much. It's a pleasure to be here. I'm excited about my next year.
All right. Well, today we're going to talk about something pretty basic, but pretty important, just conducting basic physical exams on horses. So can you get us started by explaining why it's important to conduct a thorough physical exam and what can it help you learn about the horse?
Well, in my opinion, it's the most important thing you're going to do because it's actually going to tell you everything you need to know about the horse. If you do a thorough examination, you will, and there are different types of examinations we're going to do depending on what the presenting complaint may be. But if you do a thorough examination of that body system, you should learn everything you need to know. And frankly, some things are not taught in school as well as they should be, or they're taught very briefly and you don't develop the skills. So for instance, a respiratory examination, in my opinion, and I'm only speaking this way because my wife's an internist and I've watched her do this, but sinus percussion of the chest, again, you're listening, you're getting information. Issues I see, especially with young people, easiest thing to do is to do a test, get some laboratory work, get a radiograph, an ultrasound. But without those basic physical knowledge, you don't know exactly what that stuff means. So that's why the physical examination is utmost importance. And then here's a philosophical thing. I think it's so important, it should be the biggest thing we're paid for. But we actually get paid for doing other things. I mean, doing tests, radiograph, everything, all these other things, which frankly are good information, but they're not the ultimate thing we're doing.
Yeah, that's a really interesting point. I definitely agree with you there. So I guess prior to conducting your physical exam, I imagine you want to get a good history on the horse. Do you have any specific questions you'd like to ask owners before starting the exam? Anything specifically that will help you with your examination? Well,
and again, it will depend on the basic examination. So for me, what I do is mostly musculoskeletal examinations. But again, depending on your examination, there'll be specific things you want to know. Specifically, when did this problem start? And then once you know that, then you need to work back because there's other things because here, somebody's already tried doing something. Good, bad, or indifferent, but what you need to know is what they've done. Has the horse been rested? Have you changed their diet? Have you added supplements? No matter what you see, I will almost promise you every time people have tried doing something to do it on their own. You need to understand that. And sometimes that can be hard to work out because people don't want to tell you. Because they're afraid of being judged. And it's like, no. And over the years, I developed different ways to get information out. So when I was at the university, I always made sure the students went out and asked a whole list of questions. And then they were always amazed when I came out and owners told me different things. And I'm like going, well, the reason is because you warmed them up. And so when I was in regular practice, I'd always have my technician, or if I had a visiting student, have the student ask questions, which gets the client thinking about it. And then you can come out and you can ask the question slightly differently, or you can put it in a slightly different context. And then you start getting information that you can start to tweeze out to exactly what do you need to know. I need to know what medications or what things have been done. I need to know how long this has been going on. All right. He's got a snotty nose, but he's been coughing for 3 weeks. So I didn't bother to tell you. It's things like that. Or, yeah, the horse is, I noticed a lameness yesterday. Well, yeah, but he's been stiff for 3 months. It starts to give you a bigger idea what the real problem is. Or, yeah, I rode the horse yesterday and he felt off, but I hadn't ridden the horse for 6 months. Going, okay, so you don't know anything. So this problem could be 1 day or 6 months old. So it's tweezing that information out that can be really important. And then everything you see will have its own specific questions you want to ask about, which is way beyond what we can do here in a short period of time.
Right. Yeah, that's such a good point that usually by the time the owner has called the vet, the issue has probably been going on for some time and they've maybe tried to, do some things on their own. So it's always great to figure out what the actual information is.
It's human nature. How many things do you treat yourself for before you go see a doctor?
Yeah, exactly.
So how much aspirin or ibuprofen did you take before you go see somebody about that horrible pain that you have that's not going away? Yeah, okay. And then you don't tell the doctor that you've been overdosing yourself. Yeah, see, it's stuff like that. So it's the same thing happens, and you have to tweeze it out. There's no guilt involved, but it's important information to know.
Right. Today's episode of the Disease Du Jour podcast is brought to you by Bimeda Equine. Bimeda might be the biggest animal health company you've never heard of until now. Bimeda's products have been trusted by veterinarians and owners since the 1960s when their Irish roots began. Bimeda is one of the largest producers of dewormers like Equimax, Bimectin, and Exodus. World-renowned equine athletes also rely on polyglycan, a patented formula that replaces lost or damaged synovial fluid, and Confidence EQ pheromone gel, which reduces and prevents equine stress. Consult your vet and visit bimedaus.com to see where to buy. So, can you walk us through sort of your standard physical examination? I know this is going to vary based on the issue that the horse is having, but what does your typical process look like from start to finish?
So my process, and let me just talk about a musculoskeletal exam because that's what I do. So my basically process will go, somebody's already gone out and chatted. The other thing, I always want the owner with me so we can continue to have this conversation. And I always like to make it a non-stressful thing. So the owner isn't holding on to the horse and being nervous about, I have my assistant go out and start moving the horse. They start walking it, and I'll start trotting it back and forth. And I can have a nice conversation with the owner or whoever the caretaker of the horse is, and we can start tweezing out information in a really low intensity thing. And at the same time that's going on, I can start to observe the horse. How does the horse stand? How does the horse walk? How does the horse trot? How does the horse move in general? And then we would increase to more movement on a lunge line back and forth. So this is all an assessment of how the horse is moving. And even as you see things, that may bring up another question I want to ask. Have you felt this horse dragging? You've seen this horse dragging a limb? Because I can see it now on a lunge line. Is this the normal way this horse moves? Yes, no. And so it all starts fitting together. And then we get to the absolute examination. And for me, it's a nose to the toes. So literally anything in this horse's body can affect their gait. And you go, what? Their teeth can affect their gait? Absolutely. Because how is it going to affect their gait? You're going to put a bit or you're going to put something on that horse's face that could put pressure on those teeth that can bother the horse in such a way. So it's basically an examination. It can be quick. You can go and push pressure in different points to see if that bothers the horse. So hands can just follow along where a bridle will be. So whatever kind of standard headstall bridle they use, you can put your hands on that and go across. At the same time, you're feeling joints. You can feel the TMJ joint. You can ask the horse, how well they're going to chew side to side just by playing with their gums, and they'll start opening their mouths and stuff. And this is non-irritating. This is low hanging fruit that you can look at. And then I palpate literally, we've gone from his toes up to his pole and then down through everything and palpate, and you're talking at the same time. How does the horse do this and this and this? And, over the years, I've had several people would come and go, well, it's a left hind lameness. And I go, I realize that, but there's a lot of horse here. And I want to understand how every part of this horse is affected by what you're feeling, seeing, and combine that with what I'm just feeling and seeing. So let's get a whole idea. And then most people are really good about it. So it's one, clients on your side right away. Two, they're out of your way and you're doing your physical examination. But it's literally, for me, I want to palpate every joint that I can in that horse. I want to feel the muscles around that, heat, pain, swelling, mobility, and it's going to go through 4 limbs, a neck, a torso, a hind end, a croup, and you're going to go through everything stepwise. And with a stepwise examination that you've done again and again and again, it's easy, it's quick, and you're getting lots of information from it.
How do you start to decipher subtle abnormalities, especially if it's a horse that you don't know particularly well? Is that just a matter of experience and, repeating the process over and over? Or do you have any advice for how you can sort of start to notice if something's awry?
The beauty of a horse is it's got 4 legs. So you can always check the opposite one to see what they're like, And symmetry is a real thing. It should be fairly symmetrical. And if there's an asymmetry, then it's real. Now, then you have to figure out, why is it asymmetrical like this, but that becomes real. Something to test that when I press on here, if the horse gives me a pain withdrawal and I don't see it on the other side, that's probably really pain, or if I do this and the horse has a spasm and I do it to the other side and it doesn't have it, at least for this horse, that's asymmetrical. Some horses can have this on both sides, and then spasms aren't normal things. I mean, normally our bodies don't start shimmering and shaking for no reason. So these are all things that take into consideration. Now, the other note is that when you're looking at all this is information. Write it all down. You're going to assess it, and then you're going to take 5 steps back here in a minute, and you're going to look at the whole picture and see how it fits to start drawing conclusions. But the first thing you have to do is you have to gather information. I like to think of this as like solving a mystery. You need all the information. You take your favorite character from literature, Sherlock Holmes or Hercule Poirot, whoever, but they always need all the information, and then you can start to draw these conclusions. They're going to give you the right answer.
Yeah, that's such an interesting way of looking at it. So I guess sort of on that same topic, what do you hope to learn about a horse's lameness just through the physical exam alone, and how is this going to inform your diagnostic imaging recommendations?
So what I'm going to find out, and so manipulative tests will be involved. So there's a number of tests that are going to be involved. They're just physical examination tests. But by the end of this, I hope to have an area that I find the horse is painful in this area. These things exacerbate this horse's pain. Now, once you're from there, I want to confirm that, and you can confirm that through other diagnostic tests. So it'd be, local analgesic injections if I can, or intra-articular analgesic injections, etc. But I want to have as much information to have it localized to a region. So once I have it localized to a region, then you have to decide from an imaging standpoint, am I looking at hard tissue or am I looking at soft tissue? If it's hard tissue, a radiograph is going to be the best place to start. It may not be all the information you want. Or if it feels like it's soft tissue, then I'm going to use an ultrasound to get it. There will be cases where, I'm not getting anything. I want more information. And from those sort of cases, then you have to resort to other modalities. So this is where physiologic imaging can be helpful. And physiologic imaging is imaging that actually tests certain aspects of your physiology. For instance, scintigraphy with the substances we use is going to look at bone remodeling. I'm putting that in quotes because what it really does, it measures osteoclastic activity. And so it gets absorbed by the osteoclast. The more osteoclast you have that. But the more osteoclast you have, you're having some sort of bone remodeling. You only have bone remodeling when you have trauma or some stress that's doing it. The other imaging modality that can be helpful with this is thermal imaging. Much more temporal because it can change with a lot of factors, but it can lead you to an area to start doing more imaging. So that's what you need. You had it exactly right. I need to get it, localize it to a region to start looking at these things. And then knowing what I can learn from each of the modalities. Radiographs will tell me a lot about bone. Ultrasound will tell me a lot about soft tissues. And if the radiographs aren't as clear or they're confusing, then you're stepping up to do CT or an MR or something like that. But I try to start simple and get complicated.
Right. And hopefully that can, make the diagnostic imaging a lot more accurate the first time.
Well, and that's the point. I want to get everything I can, but I want to do at least cost for the client as well. And I need to understand how the horse feels about this. I find a lot of, especially younger people, they want to jump. Hey, we're getting an MRI. Yeah, an MRI will give you a lot of information, but what does it really tell you? I mean, if you look at a lot of the MRs that come back, I've got a list of 10 things that are maybe wrong here. So some are more chronic, some are more acute, and who's the bad boy here? If I had done a really thorough physical examination, I'll understand what the horse is feeling more than. And then I can interpret that and more specifically apply therapy to what I just learned. But if I jump into this without this information, then it's sort of backwards, in my opinion.
Right. Yeah, because sometimes things might light up that aren't even related to the exact issue that you're dealing with. And so
exactly. Take a simple thing like a hoof imbalance. Hoof imbalance can create pain on its own. Hoof imbalance can also start to damage soft tissues. Now, do I need to have all this information if I can look at this or start simple and, hey, let's just fix this out so the horse is landing on its legs better, and maybe that will solve the whole problem? Or can I adjust certain things just here so I can see how the horse's posture changes so I know I'm going to have some effects on this before I jump in and spend copious amounts of money that's going to give me lots of information that I'm going to be scratching my head about. Because how does it all fit together? What's the real problem? And I always like to point out, too, is that we don't know exactly what normal is with some of this. I know what a normal MR is supposed to look like, but I don't know what a normal MR would look like on a horse that's been competing at the elite levels for 10 years.
Right.
Are their tissues going to be different than the one that's only been doing it 1 year? Or will they be, exactly. See, the question is they're going, yeah, there should be changes. We learned this about radiographs. So how will it be much difference? Because the horse will adapt through all these things. And if I don't know what the adaptive changes are, it makes it more difficult to interpret.
Right. That's such a great point. Do you have any advice for veterinarians who want to improve their physical examination skills?
Absolutely. And I don't want to sound like a smart aleck, but the easiest thing to do is go look at normal horses. And what you can do, you can do two things this way. You can help people out. So if there's a local rescue and they have horses there, you're going to see a whole mishmash of horses. But for the most part, they're going to be normal in some ways and abnormal. Just go do physical examinations on them. You're going to be helping these people out because those horses need that. And you can start keeping data on them, so you help out somebody that needs help, and you're going to be learning the whole time. This is one of the reasons I tell people that if you're a young person and you feel like this, one of the best things you can do for yourself is go on an equestrian trip where they go look at horses in the poor regions that need veterinary care. But these are all horses that work for a living every single day. There's lots of things you're going to learn. You're going to learn what horses can actually live with. You're going to learn physical examination skills because you got nothing else. You can only use your physical examination skills to come up with an answer. So, and there it is. And you will see a lot of animals all in a short period of time. So you can start to help your brain start to accompany this. And when you think about it, what have you really seen in school? You know, you may have got to palpate one normal horse or cow or whatever you're looking at. And then when you're in clinics, you see abnormal things. And somebody's pointing out the abnormal things to you. So you're learning all these things and you're trying to add it to your book. But those skills of knowing, you know, what does this feel like versus this feel like, and what can a horse actually deal with, and it's not a problem, and this is a problem. And I think that's where looking at as many animals as you can, and that's why people jokingly say experience is such a good teacher. Yeah, because I've seen 15 of those, and this is how those turned out. And you know, yes, the book has information about that, but the book didn't look at your 15. Your 15 will be unique to you, or 20, or whatever it is. But that's how you're going to learn. And I think seeing the most normal animals you can, or close to normal, is the best way to hone these skills.
Yeah, that's great advice. There's no replacement for hands-on experience. Do you have any advice for veterinarians who might be in mentorship roles or in academia for helping new veterinarians improve their skills?
Absolutely. And again, it's going to be talk somebody through your examination, how you do it. You know, is that okay? In 5 seconds, how can I actually check if the horse's teeth are bothering this horse today at that? You know, it's like, you know, you can run your hands right against those teeth on the outside of the gums, and the horse flinches. Okay, there's going to be a sharp area in there. I don't know exactly what it looks like, but it's not normal. And so it's little things like that. But somebody walk you through, and I think that's what every mentor should do for their mentees. Walk you through the exam, walk you through how your brain works as a mentor. We all work a little bit differently, and that would be like take 10 minutes out. That's all it's going to take. You know, and then you can go and look, and once you have free time, you can go do it yourself, because that's the only way you're going to learn. I can show you doing it 5 times the way I do it, but until you go do it and feel it, smell it, taste it, whatever you need to do, you're not gonna. It's not going to imprint on you.
Well, thank you so much, Dr. Turner. I think this has been really great advice for all of our listeners. Do you have anything else you'd like to add before we wrap up today?
No, and that's it. But I will harp on learning those physical examination skills. And if you're an animal owner, and I know every veterinary student has had a dog or a cat, that dog or cat has gone through a lot during veterinary school because they became a guinea pig. if you treated your animals like I did, and I had the advantage of I also owned horses at the time, so I palpated my horses again and again and again, you know, and did it from an anatomical standpoint. Once I learned the anatomy, can I feel this thing on the horse? Yeah, and that's what it's all about. Start to translate those things, and then start to translate the motion and put it together in your own head. The book only takes you so far. Your hands will take you further.
I want to say a big thank you to Dr. Turner for joining us on this episode of Disease Du Jour, and another thank you to Bimeda for sponsoring this episode. And thank you to our listeners for continuing to support Disease Du Jour. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.